Today, there's a growing debate about whether folks should be wearing those face masks as a protective measure. Since the crisis began, of course, the U.S. health officials have really repeatedly told folks that are healthy that they're not needed unless they are caring for someone who's sick. But now experts seem to be disagreeing. We'll take a look as ABC's Steve Osunsami has the details.
It may be one of the more simple tools used to help stop the spread of communicable diseases, the face mask. And in the fight against COVID-19, both the CDC and the World Health Organization continue to state that only healthcare workers, caregivers, and people suffering symptoms should wear them. But some leading specialists from Asia, where the disease first struck, are saying this morning that face masks may have played a role in helping them contain the coronavirus outbreak. And not hospital-grade masks, just masks made of fabric. The head of the Chinese Center for Disease Control and Prevention told Science magazine that the big mistake in the U.S. and Europe, in my opinion, is that people aren't wearing masks. Many people have asymptomatic or pre-symptomatic infections. If they are wearing face masks, it can prevent droplets that carry the virus from escaping and infecting others.
People should be wearing a mask from the data we've looked at whenever they go out in public.
Jeremy Howard, a research scientist at the University of San Francisco, wrote an op-ed in the Washington Post highlighting data from COVID-19 success stories in Asian countries such as South Korea, Hong Kong, and Taiwan, where everyone is wearing masks.
So I've analyzed 38 scientific papers that have looked at the relationship between using masks and the transmission of COVID-19 and similar kinds of viruses, and they all tell the same story, which is that wearing a mask can decrease transmission by up to 50%.
Here in the U.S. in late February, the U.S. Surgeon General shared this on Twitter, saying, seriously, people, stop buying masks. They are not effective in preventing general public from catching coronavirus. The government's advice is in stark contrast to what people are practicing in countries such as Japan and South Korea. Again, these are not N95 masks that health workers desperately need. Some health experts believe one reason U.S. officials have discouraged people from buying masks is because the N95s are in short supply.
So if you go and buy up N95 respirators, that means there's going to be some doctors and some nurses who will have to make difficult decisions. You know, they might have to reuse their N95 respirator or try something else.
But Howard believes that even a homemade cloth mask could be effective.
The mask part of this recipe costs about 10 cents per person, so let's just go ahead and do it. We know it works, so let's get going.